everybody, Dr. Hunt here to talk to you about Patient IQ. First, I want to say thank you for all of your help. This is a really important initiative at our center. I think it's really important toward our gearing toward being a center of excellence and being widely recognized. I think more importantly, it's really important for us in taking care of our patients. These scores really help us day to day with guiding patients toward decision making on their treatment and also showing them how they're improving after their treatment has been implemented.
We are so happy for you to be a part of the Center of Excellence. And as you have noticed, as part of a Center of Excellence, we do things differently here at the Inverness Center. One of the unique parts of our medical care is capturing data from each of the patients that walks through the door. And we actually use this data for their visit on the very first visit when they come here.
Our patients have things that they come to see us for that are really important to them. And unless we ask them what that is, it's really hard to know. Patient IQ and using outcome measures creates a way that we can create these conversations with our patients. Our patients are going to answer a series of questions about what they can do and what they can't do. We can then reflect upon that outcome measure and decide what are the things our patient is struggling with. And from there, then be able to open that conversation up to the patient. I see that you're having difficulty climbing stairs. Is this a problem for you? Do you have stairs in your home? Asking that patient if that is an issue for them. That patient may never have to go upstairs and they may not care if they ever can. And we can gain a lot of information just by filling out that outcome measure.
We use it real time. The other area that we use it real time is in patients post-operatively or after knee post-intervention, where you can say, where do you compare to norms? Also, where do you compare to where you historically were? So if a patient comes in at 3 months and says, gosh, I'm still having some discomfort in my hip, that may be completely normal at this point in the pathway, and you can show, compared to 6 weeks ago, you're doing markedly better. As we all know, one of the big factors on how patients do after any intervention is what they expect they should be doing and how they feel they're coming along. And they can have some real objective data showing where are you at in the process.
So we realized very early on as providers how important it is that we collect information from patients about how they're doing. So Patient IQ came about because it's a really efficient way for us to collect this data from patients. It's got an easy interface, it's easy to log in, it's easy to complete the information, and it allows us to see it on the dashboard when we log in.
When a patient comes to therapy and they've already completed their outcome measure on Patient IQ, it is incredibly helpful for our therapy team. From a therapist perspective, if that patient arrives to their appointment and they're waiting for me in the waiting room for 10 or 15 minutes, one of the most important things they can be doing is completing their outcome measure. It usually takes a patient somewhere between 2 and 5 minutes to complete an outcome measure. And so if they've done that in the front lobby while they're waiting for me, that gives me 2 to 5 more minutes of quality time that I can spend going over the outcome measure with the patient, discussing how it is going to get implemented in our plan of care, discussing what's important to that patient.
So Patient IQ is an essential part of how we're going to be treating patients both now and in the future. As medicine evolves from a fee-for-service, volume-based care to how your patients are doing or quality of care metric, Patient IQ and collecting this data is going to be essential to prove that different interventions are actually effective and should be covered by insurance. So it's going to be an essential part of the orthopedic pathway moving forward. So
reported outcomes are really critical in the medical industry right now, and they should be something that are looked at that help us drive quality, consistency, and best practice. When we're using an outcome measure to assess how our patient is doing, we're getting an objective, valid measurement about what they can do right now compared to what they could do before, or later on what they can do in the future.
We have a lot of information that really helps us with their care, and that's a very unique part of medicine that has really not been done at any other centers. So we're thanking you for being a part of this, because it all starts with capturing this information when they come through the front door. We have to have this information on every patient who has a clinic visit with us, whether it's in physical therapy or upstairs on the second floor or on the fourth floor with regards to them having surgery. So this isn't an optional part of the care. This is a mandatory part of being seen at the Inverness Center. And the same thing is true with your jobs. You know, this is mandatory that we collect this. This isn't an optional thing. So thank you for helping us with this and doing your part and to really create this center as a very unique center of excellence. Thank you.